Prevention is essentially one of the major objectives of modern medicine, particularly for cancer. This is extremely important. Preventing cancer and the major benefit for the society, for the individuals, because it avoids going through the suffering of the disease and sometimes of the treatment. Two of the best known risk factors for cancer, but also for other diseases, are obviously tobacco and alcohol in our societies. Just by reducing the number of smokers and number of cigarettes smoked, we have saved tens of thousands of lives. Alcohol is a more complex story because we know that a very moderate consumption is overall associated with a slight improvement of life expectancy. But we also know that as soon as you go beyond the 3 or 4 glasses of wine or beers per day, you actually increase your chance of premature death. So these are two factors which are extremely well documented and where the society can do a lot to prevent diseases and suffering. It has been known since a long time that overweight and sedentary lifestyle predispose to cardiovascular diseases and diabetes. Being overweight and being sedentary also increases substantially the risk of developing some of the most common cancers, like breast cancer, like colorectal cancer, endometrial cancer, and many others. It is now estimated that about a quarter of all cancers that occur in UK are related to lack of physical activity, overweight, where unbalanced diet is a much more complex area to define, but in a nutshell we can say a diet that is much too rich in animal protein, much too poor in vegetable protein and vegetable food, and whole grain cereals. One of the major discoveries of the past decade is that many of the risk factors for cardiovascular diseases and diabetes are also risk factors for cancer. We know that to be physically active, to maintain a controlled weight, to have a balanced diet with a good component of vegetables, fruits, whole grain cereals is good for preventing cardiovascular diseases, type 2 diabetes, and cancer. So we have a fantastic tool for the society to prevent chronic diseases. Researchers agree today that about half of cancers could be prevented via changes in lifestyle, and more specifically, it is estimated that overweight, obesity, lack of physical activity, unbalanced diet may contribute to a quarter of all cancers. By improving lifestyle, improving living environment, we could potentially reduce by 50% cancer incidence in UK today.